New COVID-19 Delta Plus variant found in United States and United Kingdom. Officials in the UK and the US have discovered a novel COVID-19 strain that is more transmissible, raising questions about its ability to escape existing vaccinations. Delta Plus is a new version of the B.1.167.2 Delta that was developed as a byproduct. Since then, additional mutations have been discovered in the Delta sublineage strain, including those that disrupt the spike protein, as reported by the BBC. According to a study published on October 15 by the UK Health Security Agency, the A.4.2 variation has now been discovered in the United States, Denmark, Israel, and the United Kingdom, where it was identified in 8% of all COVID-19 samples sequenced starting on September 27. The Centers for Disease Control and Prevention have classified the A variations as variants of concern in the United States. The number of sequenced COVID-19 instances linked to the A is unknown at this time. The 4.2 version is listed with the other A variants by the agency. Even though it's not obvious whether the Delta Plus version is more contagious, head of the Clinical Research Unit and University College London Professor of Operational Research Dr. Christina Pagel believes it's conceivable. At best, A.4.2 is just around 10% more transmissible than Delta, according to Pagel's email to Health. Professor François Ballou, head of the Genetics Institute at University College London, stated, however, that a 10% rise in transmissibility did not explain the current spike in cases in the UK. According to Deadline, assuming a 10% increase in transmissibility and a 10% frequency only results in 1% more cases every 5-day viral production interval. A research conducted by Germany's Leibniz Institute for Primate Research and released on October 11 found that the Delta Plus version of the virus is more effective at infecting lung cells and resisting therapy than the other two variants. Researchers discovered that the Delta form of COVID-19 is especially resistant to monoclonal antibodies, which may help keep patients with COVID-19 out of the hospital. The same research showed that combining vaccinations from Oxford AstraZeneca and Pfizer BioNTech may protect against both the Delta and A.4.2 variants. The combination of two vaccinations may therefore result in an especially robust immune response against SARS-CoV-2 variations, the Leibniz Institute researchers said in a news statement.